Hi, my name is Dave, and this video is all about a treatment that I came up with for benign prostate hyperplasia. I'm not a doctor. This is not medical advice. This is just me sharing an experience of what I did that seems to have helped me with my BPH, and I hope it's helpful for other people. But you have to assume any liability for any risks. That said, I think this treatment is basically safe. It's just a simple massage technique, and I hope it works for you. And if it does, I hope you'll consider maybe throwing a tip or donation my way as a way of saying thanks. In this video, I'm not going to explain in detail what BPH is or how it works because I assume most men who have come to this video already know. Instead, I'm going to try and keep this down to just the points that you need to know to decide if this might work for you. So I've divided this video up into 3 different sections. The first, I'm going to be talking about the symptoms that I had so that you can compare and contrast to your situation and decide if this is something that might work for you. The second section is basically the how-to, where I'm going to describe exactly what to do in this treatment. And then in the third section, I'm going to talk about the results that I had, again, so that you can have a baseline of comparison to see if this is something you think is working. So let's start off with the symptoms. So I was diagnosed by several urologists and a couple different doctors as having BPH, or benign prostate hyperplasia, which is just an inflammation or enlargement of the prostate. Now, what's important to note about this diagnosis is that what doctors did is they took ultrasounds and other measurements and saw that my prostate was an enlarged size, but they didn't do any biopsy or anything to determine exactly why. And as I'm sure a lot of men watching this video will know, it's not generally known why BPH happens in any case. So what that means for you is that the reasons that you have BPH and the reasons I have BPH might be different. So what worked for me might not work for you. Until more people do something like this, we're just not going to know how much my situation overlaps with other men's situation. With that said, I don't think I'm wildly unique and I'm the only person who had this particular type of BPH. So hopefully this will at least work for some men with BPH. So in my case, my prostate got up to a size of about 60 cubic centimeters. For comparison, what I understand is that a healthy prostate is between 20 and 25. After doing this treatment, it got down to about 30 centimeters. Along with that size, I had a lot of symptoms that a lot of men will find very familiar. They're referred to as LUTS, L-U-T-S, which is lower urinary tract symptoms. I just usually refer to them as the day-to-day symptoms, and that includes getting up in the middle of the night to go to the bathroom, a certain sense of urgency when needing to go to the bathroom frequently throughout the day. I had these symptoms, from what I understand, to a fairly medium degree. I've definitely heard of men having more severe symptoms than me, for example, needing to get up in the middle of the night multiple times, 4 or 5 or more times per night. In my case, I always had to get up once in the middle of the night, but always once. Similarly, my need to go to the bathroom throughout the day was very inconvenient, but not as bad as some of the more severe cases that I've heard other men talk about. So one symptom that I had that I haven't heard very many men talk about is getting urinary tract infections and fevers from those infections. So without going into huge details about it, your body is always dealing with bacteria in the environment. And a normally functioning body will flush those bacteria out through your urine. But when you have an enlarged prostate, it slows down the flow of the urine and it doesn't process that bacteria as effectively. And so the bacteria lingers in your system and it can cause infections. So in my case, I was getting these UTI fevers once every few months. So whenever I had a UTI fever, I would go to my urologist. He would give me some antibiotics and it would be taken care of within a week or so. Another cause of an enlarged prostate is prostatitis, which is like an irritation of the prostate, often caused by a bacterial infection, but like BPH, it's not always known what causes prostatitis. So none of the doctors I saw thought that I had prostatitis, but I mention it here because it's another cause of prostate enlargement that you may have that might make your situation different from mine. Other than the antibiotics I took whenever I had a UTI fever, I never took any medication for prostate enlargement, and I don't currently take any regular medications for anything. When it comes to just general lifestyle and diet, I generally try and eat healthy and exercise and that sort of thing. I didn't make any particular dietary or lifestyle changes specifically for doing anything about my prostate. But I would recommend to anyone that it's always good to be in good health in general anyways. It can only help for something like this. Okay, section 2, the treatment. So for setup, the first thing and most important thing is you're going to need one of these. It's a massage gun. This is the one I used. There's nothing particularly special about it. I think most massage guns will be fine. The two features that you're going to definitely need is one, you're going to want it to be as strong as possible because we're going to be transmitting this vibration fairly deep into the core of your body. If you find it's too strong, you can always turn it down a little bit. The other feature you need is an attachment with some amount of give, either a soft plastic or a slightly hard rubber, something like that. Because you're going to be pressing this up against your skin and holding it there, and you want to be able to transmit all the vibration effectively into the body. If you have a hard attachment, it's going to bounce against you and it's probably going to hurt. The other thing you're going to need is some kind of clothing like underwear or light athletic shorts, any kind of fabric that's so thin it's not going to inhibit any of the vibration. The reason is because you're going to be pressing the massage gun up against yourself, and even though you're not going to be moving it around much, the vibration might still cause some friction, which might irritate your skin a little bit. So the fabric is just to help prevent that. The last thing is, I always did this standing up. I don't see why it wouldn't work if you were lying down or even sitting. You would just maybe have to adjust the angles a little bit. But if you want to emulate me and do what I did, I always did this standing. So if you put your hand against your stomach and move it downwards, pressing in a little bit, as you get to the bottom of your abs, you're going to feel your pelvic bone. Now, your prostate is behind the pelvic bone in by about 6 centimeters, sort of near the center of your body. Now, if you keep feeling down, you're going to feel the edge of your pelvic bone, and below that is just soft tissue. Now, when I say soft tissue, obviously there is a very important organ right there. And assuming you're not wildly excited by this process, it is, for the time being, soft tissue. So what we want to do is we're going to want to press the tip of the massage gun just under the pelvic bone, aimed up towards the prostate. Now, in order to do that, you're going to have to push things down a little bit to flatten out that area below the pelvic bone so that you can get a little room to wedge this under your pelvic bone. You don't need to push down or pull down too aggressively. You just need to create a little bit of space where you can place this up against your body so that it's under the pelvic bone and aimed up towards the prostate. This will be awkward. The body just isn't built in a way that's going to make this convenient, so you just have to do your best. You're going to be jostling for space a little bit. The tissues underneath the skin in that area are not going to move to a convenient position for you. So just do your best. Now, while I'm at this point, you might be wondering, might it not be easier to go above the pelvic bone? You're certainly welcome to try. That's where I started out. But actually, I found that the muscles and tendons and fats above the pelvic bone create enough of a wall that they prevent the vibration from penetrating deep enough into the body. You might also wonder, is it not worth it going all the way under? Again, you can try that, but there are bones and tendons and muscles in that area as well that you're going to have to get around. So you have the exact same challenge as going in front under the pelvic bone, with the added difficulties that you have to reach further and you're going to have more extreme angles. So my recommendation is to go in front under the pelvic bone. And there may actually be another reason why that's more advantageous, and I'm going to get to that in a second. Now, when you're set up and you've got the massage gun pressed up underneath the pelvic bone. You're going to want to press it fairly firmly. You're not trying to push it in to try and get closer to the prostate or anything like that. Don't push it in enough that it hurts. Nothing about this process should cause any pain. You just want to press it enough that you have a very firm contact so that you can be very confident that all the vibration is being transmitted into the body. You're going to want to set this to the highest setting possible in order to try and get the vibration as deep into the body as you can. Now, that may be uncomfortable at first, and what you might want to try doing is setting it to a lower setting and get used to it and then work your way up. That's what I did. When I first started out, I had it at about a medium setting, and then as I got acclimatized, I eventually started turning it up more. And it only took me about a week or so to do that. So you may want to try that too. So you've got the massage gun pressed against yourself just under the pelvic bone and aimed up a little bit towards your prostate. Now, how do you know if you're actually on target hitting the prostate accurately? Unfortunately, you don't. The body doesn't really have the right kind of nerves in that area to let you know if you're hitting one organ more than another organ or anything like that, or at least that was my experience. I never felt any difference. Now, I do recommend that you look online or talk to your doctor to try and get a sense of exactly where your prostate is. There might even be some individual variation, but for the most part, you want to just try and do your best to aim using what you know about where the prostate is located. So that means underneath the pelvic bone and aimed just a little bit upward in most cases. Now, the more important part though is don't worry too much. This is not a laser, so you don't have to be exactly on target every time. The vibration comes off this in a fairly wide cone. When you do this, you're going to feel your whole pelvic area vibrating to some degree. So the prostate is going to get some of that no matter what. Still, you want to try and get the center of that cone on the prostate as best you can. So there's a couple tips for how you do that. One is you can try moving around a little bit, just adjusting the angle just a little bit side to side or up and down to create sort of a sweep in which you're going to pass over the prostate at least a little bit. I usually didn't move around too much. I usually just found what I thought was the most likely to be the most accurate aim at the prostate and just held that position. Sometimes I would move once or twice. The most important thing is that whether or not you're exactly on target any one time is not going to make or break you. The important thing is over time to do your best to try and be as on target as possible. And in the long run, you will hopefully hit the prostate often enough to give it a sufficient dose of vibration over time. Now, there is one more thing that I can't say for sure this is definitely a factor. I think it might be. It's worth talking about, but I can't promise this is something that's actually happening. Underneath the skin in that area, there are a few different tissues, and the vibration may move along different tissues at different rates. One of the things in that area is your urethra, which is the tube that goes from the bladder and carries urine out of the body. Now, when you pull things down a little bit, you can't help but pull the tissues in that area a little bit taut. And when you make them taut, they might conduct vibration a little bit better, like a guitar string. So when you're pressing the massage gun up against your skin in that area, hopefully you're transmitting some of that vibration up the urethra. And if so, that will be good because the urethra goes right through the middle of the prostate. Again, I can't promise that that's always happening, but I felt in some cases that I could sense some difference in how the vibration was moving up and down the body. So hopefully that's a factor. And if it is, that's another reason why going under the pelvic bone in the front of the body might be a little bit more advantageous than other positions. But like I said before, you're going to be jostling for space a little bit. Each time you do this is going to feel a little bit different. So just do your best each time, and hopefully in the long run, you're going to get good results. Now, how often do you do this? What I did was once a day, every day, for about 2 minutes. I usually intended to go for longer than 2 minutes, sometimes up to about 5 or more, but It's actually kind of surprising how boring something like this can be, even after just 1 minute. I timed myself sometimes, and I found it usually was about 2 minutes, but you can certainly go longer if you want. I do it at night. It's become part of my regular routine for going to bed. But to be honest, I don't think the time of day actually matters. I think it's just important that you do it at least once a day. So it does raise a question. Could you potentially see faster results by doing it more often or longer per time? It's certainly possible, and you're certainly welcome to try. I think you should not expect that this is something you could bring down to being something you can do in just a few weeks or months or something like that. But it might work. However, also keep in mind, though, that it's possible that I did it more than necessary. For all we know, 1 minute per time or once per week is going to be enough. We just won't know what the optimal balance of frequency and time is until more people do this. But for right now, what I did and what worked for me was once a day, 2 minutes per day. And since we know that worked for me, that's the current standard. So, talking about results, there are, as mentioned, no promises that this will work for you at all. So I'm going to tell you what I experience in terms of results so that you can hopefully use that to evaluate the degree to which this might be working for you. But this might be different for everybody. So I'm going to start with what some men call LUTs, or lower urinary tract symptoms, but I generally call just day-to-day symptoms. So for me, there were no noticeable changes for about the first 6 weeks to 2 months. Now, the timeline is a little fuzzy because at the beginning, it took me a little while to figure out exactly how I want to do this and to get into the habit. And of course, it's not like the symptoms just turn off one day. Conservatively, it was around 2 months that I started noticing any changes. Specifically, one morning I woke up and I noticed that I hadn't gone up in the middle of the night to go to the bathroom, which is something that hasn't happened in years and years, so it was a pretty significant change. Now, that's not to say that from that time, I was then sleeping through the night every night thereafter. The next night I needed to get up. I started having nights where I would wake up and not be sure if I needed to go to the bathroom or not. But over time, the frequency of nights where I did not need to get up started to increase. And I just want to mention while I'm on the topic of sleep, obviously, sleep is about more than just your prostate. There are other factors which determine whether or not you get a good night's sleep. I'm sure you can work out the difference between the influence of your prostate and other factors. Just want to make it clear that I'm not saying this one thing guarantees a good night's sleep. But in any case, for me, just like with sleep, the other symptoms started to fade in a similar way. I would have good days and I would have bad days, but overall, the frequency with which there was improvement started to increase over time. By about 5 to 6 months, I was confident that this was absolutely making a significant change to those symptoms. And by about 6 to 8 months, the symptoms were essentially gone. Now, with my fevers, it's a little harder to talk about progress because the fevers happened at essentially random and discrete intervals. But what I can tell you is that in the 2 or so years before I started this treatment, I had 7 of those UTI fevers. And in the roughly 2 years after I started this treatment, I had 2. And now that I've confirmed that my prostate is down to about 30 centimeters or 30 cubic centimeters, and all the other symptoms have gone away, I'm feeling confident that the fevers aren't on the horizon anymore. Which brings me to the main thing, which is the size of the prostate itself. I started doing this treatment when I was at about 50 cubic centimeters, and now it's down to about 30 cubic centimeters. But what's really important to note is that my prostate size actually continued to increase a little bit after I started this. After I began this treatment, it went up by about 10 cubic centimeters to a peak size of a little over 60 cubic centimeters. And then it started to come down. So that indicates it takes a little while for the expansion of the prostate to slow down, stop, and then reverse. But even more interestingly, you'll notice if you look at the timeline that my symptoms were going down while the prostate was still continuing to increase. So almost at the exact same time that my prostate was measured at 60 was when all the symptoms had cleared up. Now that seems very counterintuitive, and I'm not a doctor, so I can't explain why that would be, but it's a little too strange to go with just no mention at all. So I do have some suggestion for how something like that could occur. So the prostate is not a perfect sphere, and it's made up of different components. And the vibration is coming in from more from one side than another. And if I'm right that the vibration travels up different tissues at different rates, then the prostate might be getting the vibration more from the inside out. Who knows? What's important to note is just that this is an uneven process. And so results might happen in an uneven way. And what that means for you is that this might happen in a different order than what I experienced. So now, going forward, there are some things that I still don't know. For example, if I stop doing this, will the prostate start to expand again? Since my prostate is now currently at 30 cubic centimeters, and I believe that a healthy prostate is between 20 and 25, I'm hoping to see the prostate come down a little further. And if it does, if I can verify that it's 25 or under, I'll stop, take a break, and see what happens. Will my prostate begin increasing in size again? Who knows, but I'm willing to find out. So there can be no promises, but it seems to me that this treatment is very low risk, very low impact, and relatively low cost compared to a lot of the other options that are out there. So for those reasons, I think it's certainly at least worth a try. So now you know everything that I know about this treatment and how it helped me, and I hope it helps you. If it does, please do consider throwing me a tip or donation to say thanks for having figured this out. But other than that, good luck.